Okay, Trevor, update from the county is positive 152, negative 2,099, pending 142, recovered 105. There have been 5 deaths, total tested 2,393, contacted 1,781. The drive-through numbers, and this should be the final numbers for the drive-through, is total calls 391. Positive 13, negative 142, pending 39, and total tested 194. Ector County Coliseum has officially closed the COVID-19 drive-through testing, and potential plans are in the works to continue protecting the community from the virus through testing and education. You know, as details are available to the public, we'll notify them. As you know, we've got applied for a CRF grant, and with those money, we'll find a way to be more proactive in addressing the COVID-19 as well as the health and welfare of our community. And although many of the cases that have been reported in Ector County can be linked to social gatherings, we still feel the need to share with the public other exposure sources. You know, the health department has noticed exposure groups related to travel, such as visiting families and others linked to work travel. Some examples we can share would be a solar company from another state that was working in and around Ector County, in which we were able to link exposure, and several cases from different correctional detention centers in other counties that have also been linked to local exposure. And some may have noticed on the dashboard that the demographics on patients 142, 143, and 144 on the county website have changed, and this is due to the 3 individuals being Crane County nursing home residents who were previously had an Ector County address, and the state has confirmed that these individuals would be considered Crane cases and not Ector County cases. And due to that confirmation, we've replaced those 3 case numbers with new Ector County cases received yesterday afternoon and this morning. And the state will follow up on all the Crane cases. And good news from the county is all the testing from the licensed nursing homes in Ector County have been completed, and all test results have come back negative, with the exception of the traveling therapist. And all the National Guard testing has come back negative from the testing that was performed on May 17th. And a little bit of educational news is on face covering information. Face coverings should be able to breathe through, should be worn anytime in public. Nose and mouth should both be covered. Wash after each use, and do not use for children under the age of 2 years old, and do not share it. That's a report from the county today, Trevor.
All right, thank you, Commissioner Schutt. Good news there, obviously. Russell, would you like to go over MCH numbers?
Yes, good afternoon, everybody. Medical Center has tested 1,267 total tests, 97 positive, and we have not had a new positive in 2 days. So that's good news. Right now, we currently have 4 positive patients in the hospital. That's down from yesterday. We had 6 yesterday, so that's 2 less. And so 4 of those are on CCU, and 2 of those are on ventilators right now. 1,120 negative tests with 50 pending, and there are not any patients under investigation or under suspect in the house right now. So that's good that we've had a decrease, and we have not shown a positive in 2 days. So we like that.
Kristen, would you like to add anything?
No, I don't have anything, Trevor.
All right. Stacy, would you like to go over the ORMC numbers?
Yes, thank you, Trevor. Odessa Regional has tested 418 individuals, still only 17 positive, so same as Medical Center. That number's been the same for a few days. 386 negative, and currently we have 15 pending. Thanks to the support of Medical Center, we were able to quick test our 2 PUI patients last night, and they were both negative, so that's good news. So we no longer have the PUI unit or person under investigation open. We do have 7 patients in our COVID unit as of this morning, and have had 2 more admissions throughout the day, so we're currently at 9. And as far as I know the 7 that were there as of my update at 9:30 were not on the ventilators. I'm not sure about the 2 that were added throughout the day, but we'll update you on those numbers tomorrow. Dr. Sarah Vanden may know that part.
Yeah, they're en route. They're not here yet,
Okay.
but we will be getting them shortly. So no, they're not on ventilators right now, but they are very critical. One more is from Crane, and another one is from Big Spring that's coming here.
Dr. Saravan, do you have anything more you'd like to add as well?
Sure. I just wanted to say thanks to Medical Center, and we're continuing to work with them. Hopefully we can share some of those Cepheid testing supplies, so we'd be able to do one of two things: either be able to run it here ourselves, or at least for the time being, run the specimens to Medical Center and have them run it for us, so we could also keep our PUI unit closed and that's very helpful on so many different levels. It's a strain on staffing, obviously, but most importantly, it's an unnecessary exposure for the staff and for the patients that we can prevent if we knew sooner that they were most definitively negative. So we appreciate that very much. And that's all I had for today. Thanks.
All right, thank you, Dr. Saravan. Dr. Benton, would you like to add anything, sir?
Just a little proverbial good news, bad news doctor approach, I guess. Good news being is the numbers are again trending nice for us, right? Bad news being, though, that the virus is still in the community, so we can't let our guard down. And now, what's in the hospitals are critical patients, of course, some of them being nursing home. So we have to keep our guard up. And I wanted to add just a little bit to Commissioner Shelton's talking about sort of strategic testing as we shut down the drive-through. So the collaborative group that we put together is still going to be operational and still continue to meet regularly, working with the city and the county to offer some testing, but that's still in development. It just won't be through the drive-through mechanism. The call center, which we've operated here in my office, the phones are just not ringing anymore. So I think it's time to change the method on that a little bit. So that's all.
Thank you, Dr. Benton. Mayor Turner joining us again today. Do you have any updates from the city, sir, or maybe anything from the governor?
Haven't heard anything from the governor. CDC has come out and kind of clarified on surfaces. So I was going to caravan after we get off to kind of clarify that. It came out and said it couldn't be. Then it came out and said, well, it still couldn't be. So working on that, very proud of the fire department and everybody's work, especially for the nurses. We need to do everything we can to protect them, and I'm very grateful for everyone's hard work. That's all I've got.
All right, thank you, Mayor Turner. Looks like we can get to media questions now. So first up I see is Danny.
Nothing for me today.
All right, thank you, Danny. And next up I see is Laura.
Hi. Stacy, your person coming in from Big Spring, is that a nursing home patient?
I'll have to defer that to Dr. Sarah Vanden. Do you know?
It is not a nursing home patient, the one from Big Spring.
Okay, but the one from Crane is definitely a nursing home patient?
Right.
Area homeowners, if you have a power meter like this on the side of your house, you can get paid to go solar for no money out of pocket. It doesn't cost anything to install. To believe.
Is anyone else hearing that?
I think somebody's computer is going off.
I was muted. What do you mean?
Okay. I didn't know where that came from.
The response sheet, my open records.
So on the CDC stuff that David mentioned earlier, the surfaces from the doctors, what do you guys know about it? Can we still, is the wisdom now that you can still pick it up from a surface, or is it not?
Yeah, they're not going back and forth. What they did was they said you could get it from surfaces, you could get it from respiratory droplets. Then they came out and said that there's a lower chance of getting it from surfaces than previously thought. They didn't say you can't get it from surfaces. But then people started to think about it that way, so they had to come out and clarify again. Yes, you can get it from surfaces, still be careful. So they're not going back and forth. It's just the way the information is being interpreted, it looks like it's a back and forth. But we knew right from the beginning it is a respiratory virus. It still is a respiratory virus. We knew that you could get it from surfaces, but we know now that it is lesser likelihood of getting it from a surface than from respiratory. Dr. Benton, anything else to add?
No, I think that's perfect. I mean,
Okay.
we've always thought respiratory viruses would have low risk from a surface because you have to touch it and then introduce it into your respiratory tract. It has to get into your body through the respiratory tract to cause its infection. So the easiest way, not the best, is to catch it through the air, through a cough, through a sneeze. That's why a mask is so important.
Well, speaking of masks, we've had some folks call us about some first responders not wearing masks. Are they being required to wear masks? And some are just, well, obviously they're not required if some aren't doing it. But what is the city telling first responders?
Let me find out exactly, and then I will call you back. I want to make
Okay.
sure I get it straight from the chief.
Okay. On the Coliseum reopening to some limited events, is there already talk of what's going to happen with the fair since it's so far away?
Okay. I went blank there for a little bit, but when I came back, you were asking on the opening of the Coliseum, has any discussions been held with the fair on whether it's coming
Right.
back? Is that the question?
Right.
That was not brought up in our meetings, but our goal is that anybody that comes in the near future or foreseeable future presents a plan, and they have to be a type of activity that the governor has already allowed to happen. So that being said, if the governor is going to allow fairs, then we will allow fairs provided they have the COVID-19 plan that's approved by the health department.
Okay. On some of the nursing home patients, Russell, your patients that you talked about that are in-house, are those nursing home patients that
No,
came
ma'am.
from out of, no, okay.
No, ma'am.
Okay. I noticed that a lot of the Crane ones are at ORMC. How are you guys deciding ahead? Are they asking for which hospital they want to go to? Or did you guys have some kind of an agreement or a plan on where they would go?
I don't
No specific reason. I think we both offered our services. We gave them our intensive care doctor's cell phone number, Dr. Thar. He's been on the front lines here with our NP and with the rest of the team. He's reached out to them and said, whatever you guys need, whenever you guys need it, call me. I'll give you some advice. Don't wait too long. Russell said that before too yesterday. Don't wait too long before you send these patients over so we can start treatment early so they have a good chance. And I think those conversations and that relationship, they're just sending them to whoever they can get a hold of, I think, and that's why we ended up getting them for now.
Oh, okay. Is it just Crane or have some surfaced here from Monaghan's?
None at ORMC from Monaghan's.
Okay.
We don't have any either from there.
Okay. Okay, that's all I had, Trevor. Thank you.
Laura, Marcos, I know you're there. Do you have anything, sir?
My question was asked already, so thank
You said your question was already asked?
you. Yes, correct.
Okay. I just see one so far on Facebook. I guess, I don't know if it was this week or last week, Governor Abbott mentioned that a peak was expected this week in Texas. I guess this would be for the doctors, an educated guess. Are we still expecting a peak this week, or do you think the state has already seen a peak? Educated guesses and thoughts on that? Dr. Benton, Dr. Cervena?
It's hard to predict. You cannot say we have peaked already this week. We don't know if it's going up or down yet. And I'd be surprised if Memorial Day weekend didn't show up in a week's time in how it's going to reflect on cases. So if there is going to be a higher number than we see today, it's probably going to be because of the Memorial Day weekend. So we'll hang tight and wait till this weekend or early next week to see what happens. Dr. Benton?
It's pretty dangerous to project what it may look like. You know, early on in all this process, there were reports out of UT system and other places, right, that had these huge projections that didn't bear out. So it's really hard to read. I feel like for us out here, since we're kind of naturally socially distanced, we may just never really see a peak. We may just kind of see ups and downs as we go. Again, like I said at the beginning, last week was actually our peak, like 6 weeks into this so far. So, I mean, it could come back around next week too, after a lot of social gatherings. So avoid them.
All right. And I think that's pretty much it. I did want to bring up next week. I know this week was Tuesday, Thursday with the Memorial Day on Monday. Did we want to go to the Monday, Thursday schedule for next week? Does that work with everyone?
Yes.
That works
That's
for me.
fine.
Yeah,
Okay.
Tuesday, Thursday. Laura, this little man beside me told me that the fair turned in their COVID plan this afternoon.
Okay.
This guy. He knows more than I do.
All right. Russell, do you want to finish this out? Something from the good word?
Yeah, before we do that, let me just briefly talk about our visitation policy. And I know we have visited with our friends over at ORMC about this, that we are really holding steady on this policy, especially we'll probably take another look at it next week, towards the end of next week. We're getting a lot of calls, and I'm sure we all are, especially with patients here that are not COVID related, about letting family members in, clergy, people, preachers in to see these patients. And we are really having to hold firm on our policy. And I know it's difficult, and especially when we get a lot of calls. Well, my mom's there, or my aunt's there, and they haven't seen anybody. We're trying to handle that through social media, like through a FaceTime call or a Zoom call. But we're really having to hold steady to that at least another week, and that's just to protect everybody. The more foot traffic we have in here, the more likely that COVID will make its way into here and not only expose the patients, which I know it's patient safety first, but then our staff is a very close second to that. And keeping the integrity of that is becoming more and more difficult. I know even though, we only talk about a handful of cases, 5 or 6 cases, you can see when you look at these nursing homes how fast this has the potential to spread through a facility. And so I'm really asking, for everybody that listens to this or anybody that has a question about it, just to please be patient and understand that we want you to be able to see your mom or dad or anybody you have in the hospital. We want the clergy here, but right now we are really just holding steady to our policy, and probably will for another week, just to make sure that we've got this under control. And I know my phone is ringing, text messages. I know Kristen's is. I can see some head noddings from our other friends that's happening everywhere. And it's not because we don't want people in here. We do, but at the same time, we have to make sure that we're being safe by all the patients and all our staff. Stacy, y'all want to say anything about that?
Go ahead, Dr. Servanen.
I was just going to add thank you for doing that, and I'm glad we're on the same page and we're doing the same thing. In fact, our ER visitor policy was actually a little bit more lax than yours before, but we've strengthened it a little bit more. We're not letting visitors even in the ER now, especially because we're going to have to hold some of those PUI patients in the ER till we get the specimen over to you to run the test. So we're just keeping it as safe as we can. This is the highest number of COVID patients we've ever had in-house. So it is not a time to lax on these restrictions. It's definitely time to hold steady and make sure we keep the community safe.
Dr. Saravan, and this is Stacy. Would you add to that what our safety plan is for the ER in terms of the isolation rooms for those patients? Because we do want the community to know that the ER is safe for them to come for non-COVID.
Yeah, and this goes, I'm sure, for both hospitals, but both of us have always encouraged the community that we are taking every precaution we can because we want to be here to provide the care for when you need it. So don't be scared to come to the ER. We have these precautions in place that we have a separate waiting room, for example, for patients that could be potentially COVID related. We have negative pressure areas where we're isolating people. We have rooms within the ER where we're putting known COVID positive patients or PUI, persons under investigation, we're waiting for the test. And they are separate from the other patients, physically separate as well as staff-wise. And I'm sure Kristen will tell you, if we have those kind of patients, those staff is cohorted to those patients. They're not interacting with COVID-related cases and then non-COVID-related cases. So they're cohorted, so we're keeping them safe. All these safety measures are in place because if and when you do get sick, we will be here to take care of you, and we want you to know that you can feel safe coming in to either one of our ERs when you have this problem. So the community message, and this is one of the big things that I have to ask the media, if at all possible, that you guys have time to run some of these type of messages, these PSA type messages in the media. You can choose to do it at 2 o'clock in the morning when nobody's watching, or you can choose to do it right in between soap operas during prime time when everybody's watching. Choose to run it in prime time. Choose to put those PSAs in there so the community can hear what we have to say. Some of the videos that Mayor Turner's team and Michael and everybody from the city has come up with, those are great videos to run. They're short, they're perfect for PSAs. Play them during your prime time and get this message out there so that we can continue to keep everybody safe. So that's all I had. Thank you.
I've been watching the TV over Danny's shoulder there to see if there's been a commercial pop up while we've been on here. But I wanted to tell you briefly, my mom was a patient here in this hospital just a week or so ago. And believe me, keeping my sisters and my family and my little Down syndrome niece out of here was not easy, but to protect everybody, including them. I mean, that was something that was just absolutely, we had to do that. And so we all understand, we all want people to be comfortable and that healing process to be as easy as possible. But just where we are today, I appreciate what you said, Dr. Saravan. I'm glad that both facilities are working this out because that keeps it from being, well, regional's letting us do this or medical centers letting us do this if we're keeping it steady. But just the message is to be patient. Let us do this work. Let us take care of the patient. And as long as this keeps heading the right direction, I can see it, us loosening those restrictions. But where we are right now, we just need to hold steady on that. So sorry about that, Trevor. I wanted to get that in before we shut it down today. So thank you for that. And I do have a quick thought for the day. Psalms 55:22 says, cast all your cares on the Lord and he will sustain you. He will never let the righteous be shaken. And I think that's pretty cool words for today. Thank you, folks.